Hello, everybody. So today we wanted to just kind of inform everybody and educate about one of the most effective modalities that we do in our office, which is decompression therapy. So that is very different from traction therapy or an inversion table. The reason being, both are great, but traction and inversion actually causes positive pressure when it's pulling your spine, utilizing gravity and your weight. So that is, again, it's not a bad thing, but as soon as you release or come up from that inversion, everything kind of compresses back down. So it's a great thing to do to help alleviate back pain, or neck pain, but it won't typically give a long-standing effect. So decompression is different in the fact that it causes negative pressure. So you got to think of that as kind of like a vacuum. So as it's doing the mechanical pull and release, that pumping action causes a negative pressure, which actually gets a disc, the cushions in your spine, to recess back in. So if you have a bulge or a herniation, or spinal stenosis, which is basically arthritic changes of the spine, or if you've been told you have DJD or degenerative disc disease, those are all things that are treated 91% effectively with decompression therapy. So I'm going to show you our model here, Jacob. You guys know him.
How you doing,
if you
guys?
haven't, he's going to tell you a little bit a story about what he went through. He actually had sciatica not long after starting working here at Health Source, and got great relief from doing the decompression because it got that pressure off the nerve. So before we do that, I'm going to show you guys the decompression table. So this is the screen. So depending on what you have going on, there's a multitude of different protocols that we can do. So as a maintenance level, with Jacob, we use what's called K5. And we can set the poundage, we set the cycles, things like that. And that's the difference of the protocol, which means how many times it's going to pump back and forth. So he actually runs at a max pull of 72. And then it's going to do a minimum release to half that weight. So 36. And a pre-tension of 18. So the other thing with this is, depending on where you have the issue or where your disc bulge is, we can actually use these newer generation tables to really target that specific level. So, for instance, if he has an issue at L5S1, we just tap that, and then you'll see the table actually move depending on where the level is. So it actually is going to cause that flexion to really target that L5S1 level. So once we do that, we close it and then we start the protocol. Now, if somebody has what's called a lateral disc bulge or things like that, you can also do maneuver this table by simply going left or right, moving it side to side, or rotating it. But with Jacob, we just do a straight pull. So I'll kind of briefly show you this. You'll see this table begin to separate and decompress the spine. But while we're doing that, I'm going to have Jacob tell you a little bit about his story and what he was doing.
So like Chad mentioned, guys, when I first started here, about the first month actually, I had sciatica down my left leg, and it actually got as bad to where my whole left foot and calf were numb at the time. And really, I was pushing a lot of buttons. Like, it was, the rehab exercises were starting to make progress. And what really put me over the edge was this decompression table. Within first 2 or 3 times for myself, which isn't for everybody, of course, but within the first 2 to 3 times for myself, I felt a real difference in that sciatic issue, and it started easing back up my leg, so to speak, at the time. So I can really attest to the effectiveness of this, and actually pairing it with the rehabilitation exercises and the other protocols we have in the office here too. So it's great.
Fantastic. Like we said, if you guys are having any kind of issues, or you've been told that you need surgery, and you haven't quite gone through all the alternatives that may actually prevent you from having surgery, I can promise you that decompression very well could be exactly what you need to actually treat the cause of the issue, to actually make it to where you're feeling good and the symptoms go away, but it also, best part, keeps it from coming back, or less likely that it comes back. So with that being said, I'm just going to show you that it is actually separating. You can see how it's just slowly doing a pull. And a lot of people say, does this hurt? Anything like that? So the answer to that is 9 times out of 10, most people feel an immense amount of relief while on the machine. And then as you gradually progress in your spine and the issue begins to heal, the spasms in your back and all that starts to go down, and then they're like, I don't even barely feel it anymore. So that's exactly where we want to be, not only making you feel better, but also making sure that this problem doesn't just keep coming back. Questions for us, please feel free to reach out. Our number is 636-220-1007. I'm happy to jump on a call with you and explain it more. You're always welcome to come in. I'll sit down with you and talk to you about the options if you're a good candidate for decompression therapy, whether that's for your neck or low back. It does do both. And if you'd like to make an appointment, I'll drop a link down in the comments that you can go to. It'll take you straight to our website, and you can find a great time for what works for your schedule, and we can get you all set up. And like I said, first, just figure out what's going on with you. Second, figure out if your decompression therapy is the right modality for you to finally get rid of that pain